Hello, everyone, and welcome to Deepwatch's webinar today. I'm Morgan Griffin, and I work here in marketing at Deepwatch, and I'm pleased to have with me today Bill Bernard, AVP of Security Strategy at Deepwatch.
Afternoon, Morgan. Good to talk to you today. So as Morgan said, I'm Bill Bernard, Area Vice President here with Deepwatch. Been in information security for 20 some odd years now at a variety of places, and looking forward to talking today about information security for healthcare providers and what Deepwatch can do to help with that.
As Bill said, today's topic of conversation is Do No Harm, Maturing Cybersecurity for Improved Patient Care. Clearly, we're in a time when healthcare organizations are prime targets for cyber attacks. You need to keep your organization secure, but you also need to help the staff keep their patients alive. I'm sure many of you joining us today from the healthcare industry may feel like the added challenges you face aren't being adequately addressed as you look to mature your security operations. So you also might be wondering why Deepwatch has an authority on the matter. So Deepwatch has been supporting healthcare customers since our inception. Healthcare as an industry is neck and neck with the financial services industry as our largest supported verticals. So with that being said, Bill, the healthcare industry has always been a prime target for threat actors. What recent impacts have made a tough situation even worse for those organizations in healthcare?
Well, thank you, Morgan. Lots of different things going on. There's a lot of new market forces, things just happening recently. We could go back and talk about the Byzantine ways that healthcare providers get paid through insurance companies and all the other different problems and issues with all of that impact the bottom line for us and impact the money available to information security. But more recently, of course, we've had some other market forces, most notably, of course, the pandemic. Lots of things happening in the pandemic. Obviously, again, as healthcare providers, more so than, say, insurance companies or data processing companies for healthcare data, or even for healthcare materials manufacturers such as pharmacy companies, pharmaceutical companies, or others making MRI machines, things along those lines. The pandemic was a real game changer for a while. You see the stat on the screen. At points during the pandemic, healthcare system income dropped 50%. That's a huge problem. Couple that, of course, with the past 2 years or so where supply chain issues made such normal things like masks. Number one, they were in much higher demand. And number two, of course, they cost 5, 6, 10, 15 times what they should have for many healthcare providers. During that same time, healthcare providers had to put off a number of their money-making capabilities, like elective surgeries, like other elective treatments, things that weren't critical were pushed off in many cases because of the dangers of the pandemic, especially before we had vaccines and vaccinations for it, and before we had a firm understanding of its transmission. We also, of course, saw this pandemic really limit the ranks of folks interested in practicing in healthcare. We had doctors and nurses leaving the industry in droves. That, of course, drove up the costs and the salaries for those that remained, and of course for others that were enticed back in. Lots and lots of economic forces recently pushing on healthcare industry and the healthcare providers, making it tough for them to have the money to spend on their security programs. A couple of other key things that have been happening besides just COVID, we've seen a huge increase in the cost of cybersecurity insurance, especially for healthcare providers. Anecdotally, talking with a few folks, I've heard numbers as high as 15 times, not 15%, but wow, 15 times, Morgan, what they had been paying, which is just absolutely scary. And obviously that money is not going to come out of the patient care budget if at all possible. That money is going to have to come from somewhere else. We also know that when healthcare data gets breached, it costs more than twice as much as when other PII gets breached. The average cost through 2020 for a PII style data breach was about $4.2 million For a healthcare data breach, for a PHI data breach, it was more than twice that at 9.2 million, which, by the way, is up over 40% or almost 40% from 2019. We also know, unfortunately, that healthcare companies for 11 years running have had the most data breaches of any industry vertical. So Morgan, all of that, of course, has led to the fact that costs are going up around healthcare information security, and those costs aren't necessarily the ones that we're looking at in terms of where do we have the money to provide information security in the healthcare provider space, but the results of maybe not having what we've needed for that healthcare security. And it's the direct result of, unfortunately, ineffective healthcare security programs that are driving up those costs for hospitals and other caregivers.
So then let's talk about how is the security focus of healthcare organizations different from most of the other industries?
Yeah, you mentioned it in your opening, right? There are some unique security focuses. Healthcare companies aren't like manufacturers where they're trying to protect widgets or intellectual property. They're not like Facebook or other online companies where their big focus is on actually sharing a lot of personal data intentionally with the entire world. They're really focused on some key things that very few other industries are. Three of those things, to my way of thinking. The first one is, of course, keeping patients alive. The emergency room, the ICU, many of those other capabilities within healthcare providers, that's their primary focus. So information security gets thought of differently. The loss of some data, not necessarily the biggest, first, most important concern for a security program in a healthcare provider. Morgan, the next thing that is very, very different is needing critical data, needing the right data to be available for treatment and for diagnosis. We've come a long way with the electronic health record systems, things along those lines, so that there are some centralized repositories, at least within individual medical systems themselves. But in an era where I don't go to the hospital for everything anymore, I go to an imaging facility to go have my MRI done, and my labs go out to some other lab, and this happens here and that happens there. All of that communication has to be kept up and working so that when I get to my appointment, my doctor doesn't say, so sorry, we can't do that MRI today because we don't have the records on what this MRI is for. Another key thing that most organizations don't have to deal with. And then finally, we get back to protecting PHI. And entertainingly enough, this is the one that we've got the most regulation around from an information security perspective. HIPAA, high tech, all the other parts of that are very, very focused on trying to make sure that we don't lose that data, that we're protecting that data. That's given us a compliance requirement, a regulatory requirement for protecting our data. But as I mentioned, I think most healthcare providers see that as priority number 3, at least in terms of their unique security focuses.
Right. And so then if the security focus of healthcare organizations is so unique, let's talk about, does that make their environments unique?
Healthcare, providers are unlike any other environment I've ever seen. Lots of unique things going on there. I think the only other environment in the world that has as much IoT material are probably the highly computerized manufacturers in most cases, but IoT is one of the number one things that makes their environments unique, because in this case, especially, IoT is about patient care. IoT isn't about building widgets. IoT is about patient care, and that part of the environment needs to be accessible to folks. The supply chain world for healthcare providers from an information security, information technology perspective is also very, very unique. I know when a lot of us think about supply chain from an information security perspective, maybe we think about SolarWinds and what happened there, how that's a tool set trusted by a great many of us. And once that was compromised, many other companies were then potentially compromised because of it. But in terms of healthcare, yes, that's a part of their environment, but probably more importantly is, as I was mentioning earlier, that distributed network of service providers have to work together to provide care. Supply chain here, I think about as the remote nursing station that's monitoring ICU patients from an offsite facility. So when that ICU patient hits their call button, they're talking to somebody in a completely different building who's checking their vitals from that Internet of Things monitoring system and who's talking to them through a microphone and speaker to make sure that they're okay, and who then has the power ultimately to summon somebody on site, be it an orderly, a nurse, etc., to bring somebody into that room. That's so very, very critical to the care, and it expands the view of what information security departments are trying to protect inside of healthcare organizations. Then we get into all the other stuff, regular business. I don't get to check out of my healthcare provider's environment without at least talking about how I'm going to pay. Oftentimes, I'm going to pay on the spot if it's a doctor's visit or other things along those lines. There's also just managing all the other IT that goes into running a business these days. Hospitals all have email systems. They've got all the other same sorts of systems that just about any industry has. And we're already, sort of third on the list of things for them to be concerned about. Then, of course, we can kind of get back to an interesting side effect of COVID. So over the past few years with our shutdown of doing things in large groups, fortunately we're coming back from that quite a bit, but as that happened, the need for telehealth visits skyrocketed. It's estimated that during the COVID period, actually in 2020 alone, a third of US adults participated in a telehealth appointment, whether it was for them or for their children or other dependents, a third.
Wow.
Nobody was using telehealth prior to COVID. It was always one of those, hey, if I'm a traveling salesperson, I'm sick in my hotel room, here's a 1-800 number I can call.
Right. Wow.
So, that's been a huge explosion in terms of the focus that that healthcare providers, security teams have to have, and now they're willingly interacting with everybody else's home computer on this front. So that's got to be good and secure. And then back to something that lots of other companies have to deal with as well, public networks. Because I know as a working professional, when I go visit a family member in the hospital, especially if I'm there for when they go in for a procedure to be done and I want to be there when they get out of that procedure, I've got a lot of time where I'm probably trying to do work. I'm probably trying to send emails and build the next presentation deck that we're going to do on a webinar or things along those lines. So I need a good, secure public network in that facility as well. So again, I think that the security teams at these care provider locations have so much to deal with and such a unique environment that of course we have to think very, very strongly and very, very carefully about how to help them protect those environments.
And so tying this all together, what then makes healthcare organizations such a top target for all of these threat actors?
Yeah, I mean, it's painful. One of the things, of course, for us is the fact that if something disrupts a healthcare environment, there's the potential for the inability to perform procedures. Reading plenty, especially over again the past year or so, as ransomware has become such a problem, reading about so many healthcare providers who have had to cancel an entire day's procedure and reschedule all of them because of an interruption to the network, an interruption that at an office of some sort might be a mere inconvenience, or at a manufacturing plant might cause office workers to be inconvenienced, but factory work can still go on, things along those lines. It's the extreme nature of doing no harm and taking care of keeping those patients alive that means that a small disruption in a healthcare environment can lead to a domino effect. And so what we see with these threats is we see people taking great advantage of that. We know that as an industry, the healthcare industry pays ransoms when they get hit with ransomware 61% of the time, according to research. That
61.
is
Wow.
61, more than half, getting up there towards 2/3, and that unfortunately leads the entire set of industry verticals that we can look into in terms of the percentage of organizations paying that ransom. That tells us a couple of things. I'm going to target somebody who I know will pay me, right? If I'm the schoolyard bully and I want lunch money, I don't looking for the big kid who could put me on the ground. I look for the kid who I don't think can fight back. And maybe that kid can't fight back because he's got a broken arm right now. Maybe that kid can't fight back because he's a little smaller than me. Whatever the case may be, I'm going to try to target the folks that I know are going to pay me, as opposed to being able to tell me, no, you're not getting my money today. The other thing, of course, and we mentioned that this is, a little further down the ladder, but we know that over the first 6 months of this year, 20 million healthcare records have been breached and lost. Good news, that's a little down from the year before, but we know that that's unacceptable as well, because again, the cost of those breaches to healthcare organizations, it makes it hard to keep up with being able to spend money on patient care and on the things that need to be done. Just to come back to a little bit of why these targets happen so much. The ransomware ones we talk about everybody paying, but the threat of interrupting service, just a denial of service attack, is so disruptive because of the days of lost procedures, because of the potential to harm individuals who are there for care in that facility. Obviously, you have a duty as that healthcare company to focus a little differently on how you're going to respond to that threat, how you're going to respond to that ransomware, because it's not about just missing a day of work. It's about people's lives and people's livelihoods and how they're going to be taken care of. We know that, by the way, ransom payments are going up. In 2021, between Q3 and Q4, we saw those payments go up 130%, not 30%, 130% to over $300,000 per incident, according to the Department of Health and Human Services. We've seen as well with PHI, we know that PHI data breaches are the tip of a particular iceberg. Going back to how healthcare is paid for, because we're so reliant on insurance, PHI data is so important for folks to get, folks that have a reason to need healthcare and not have their own insurance, things along those lines. The fraud that comes out of these data breaches is a whole other part of the problem. And again, if we can do more to reduce how a company, how an organization that's focused on patient care and healthcare, if we can help reduce these instances, we're going to drive down costs for those organizations. We're going to drive down their insurance costs. We're going to drive down their liability costs and help them have more money to spend on patient care as a percentage of the money they're spending every year.
So, I mean, thanks, Bill. You've put out some, pretty crazy stats, just in this short time. I mean, that's a lot. So, how do healthcare organizations mature their security programs to better handle all of these concerns that we've just discussed?
So this is a place where, again, because of the unique focuses, it's more important than anywhere else. But I think this is a place where we can come back and see parallels with other companies. I think we can also see parallels between information security at a healthcare provider and just healthcare provider activity in general. I'm a big fan of talking about talking about information security programs in terms of the NIST cybersecurity framework. Just to level set, I'm sure most of our audience is familiar, but just to level set, that particular framework talks about 5 key functions: identify, protect, detect, respond, and recover. I think there's parallels to that in healthcare as well. And as I think about it, I think the first thing that we do on both sides is we try to identify what the risk is going to be, what the problem is going to be. From an medical perspective, maybe we're looking for what's the new virus that we have to be concerned about. Maybe it's what strain of influenza is most pervasive this year that we need to protect people from. Maybe it's the CDC doing studies on deaths from car crashes and what might be able to be done about improving those, or injuries in high school football players, all those other sorts of things. We're identifying what the problems are, who those problems are going to impact, and how bad those problems end up being. We do the same thing in the security program. We want to identify what's the data we're trying to protect, what is the mission that we have as a security program to protect that environment and to take care of that environment. Who are the bad actors, not by name, but by activity, that sort of a thing, that are going to come after our security program and come after the data and the systems that we're trying to take care of. And what are they trying to do? Why are they trying to do it? What's motivating them? So we both have this identify phase. I think the other thing, the second one that we have in common is this protect phase. And I think in healthcare, it's easy to think about that in terms of vaccinations and inoculations. We've seen that again with this pandemic, trying to get people vaccinated. We see that every year with our flu booster shots, looking to vaccinate us against whatever strain the healthcare industry believes, or the healthcare world, frankly, believes is becoming dominant and has the potential for causing a lot of death and sickness, things along those lines. There's all sorts of other things within the medical world that are protect related. There's a reason you go in for your annual physical. There's a reason that after you hit age 40 or so, there's some procedures your doctor is going to ask you to do every few years, things along those lines. On the information security side, this is where we build our castle wall and fill our moat with alligators and do everything we can to put in the firewall, to put in all the tools that are going to keep the bad actors out. And this is a place where in information security, we tend to spend most of our time and focus. We tend to believe that the key is preventing the bad people from doing the bad things in our environment. And so there's a huge focus on protect. We buy technology, we buy hardware, we buy software. In fact, for the average organization of over 5,000 employees, Morgan, there's an average of 76 security tools in place at those locations.
You said 76.
That actually boils down to about 4 tools per employee in the information security department. And the sad thing is that number gets worse as you go to a smaller organization. Maybe a 1,000 person organization may have 65 or even 70 tools yet, but they've got fewer people in that information security department. So now we're talking 6 to 1, 7 to 1 tools per employee, because we're so focused on all these protect tools that are out there. Now, I think this is where there's a huge difference really starting, though, in terms of my analogy. When I think about the next phase, detect, in medical care, we do all sorts of things to detect what's going on. We have office visits with our primary care physician. We have specialists to help diagnose cancer and other things. We have MRIs. We have all sorts of other imaging tools. We have blood tests. We have lab work. We have all sorts of ways to detect what's going on in our environment. And this is maybe more visible to folks than some of the protect things that happen in medical programs. We don't think of protect much beyond vaccinations and other things along those lines, perhaps in the medical world, whereas, as I mentioned, in the security world, we think about protect as maybe the lion's share of what we're doing. When it comes to detect in the security realm, that really has to be all about using those great security tools that we already have in place that we're primarily using to protect the environment, to be the castle wall. And we have to look at what those are telling us about our environment. That's a team of security operations specialists. That's your SIM, that's your SOAR platform, that's your SOC. That's people monitoring what's going on, of course, with the help of lots of technology, but that's people monitoring what's going on so they can identify when something bad is happening and detect that. And a little sub bullet to that is alert against it, because It's one thing to detect what's going on, it's another thing to alert to what's actually happening in a meaningful way. Again, I think the medical team has the medical world has a little bit better, does a little bit better job here in terms of detecting what's going on than maybe we do in security because of where the focus is. And as we keep going down, we think about response. Obviously, a huge portion of the healthcare industry is built around responding, whether it's the EMS, whether it's the folks in the emergency room. They're there, along with lots of other folks, of course, they're there to deal with the problem once it's occurred. Within information security, this is a spot that we often sort of don't do as well. We've got that entire team of folks that we've hired that are so busy working their 4 to 10 technologies per day, because those are all the protect technologies they have, that who's left on your team with the bandwidth to respond when an alert happens? Who's got the knowledge to go look into what happened and try to stop it from continuing to happen? I know I myself have gone through plenty of first aid courses. If I had to, I could probably stop somebody from bleeding, might even be able to give them CPR. How many folks in your security program know how to go stop a malware infection? How many people in your security program can kick a malicious actor out of your environment? That's not skill set that we've done a good job of making sure we have, in part because of the number of people we can have on our staff, the number of people we can find, but also because they're really focused on those protect items because we've let ourselves build our programs that way. I think finally, as we look at it, the recover step. On the medical side, there's all sorts of things that we can talk about in terms of recovery. Physical therapy is just the most obvious analogy that came to mind for me, the most obvious metaphor. But on a security program perspective, maybe we're restoring from backup. Maybe we're re-imaging the systems and turning them back on from a gold image that we've got somewhere. This is another key step, though, that, oh, well, that's IT's problem, that's IT's issue. Gee, are our backups actually valid? Did our backups get hit by whoever's been attacking us? Things along those lines. So really working towards making sure that we think about this detect, respond, and recover as such critical parts of our security program, because I think we do let those sort of languish in information security, where if we look at our peers over in the medical industry who are providing medical services, we see that detect, respond, and recover is actually core to a lot of what they're doing. It's not an afterthought. In fact, sometimes it's the first thing they're thinking about doing. I think security practitioners in any walk of life could learn from that, but I think this is a great opportunity for security practitioners in healthcare organizations to take that understanding, to take that knowledge, and to be able to speak to their medical colleagues and make that comparison, make that analogy back to what they're doing, so that those colleagues, and in fact, then the C-level and the board, understand a little bit better about where spending money for the security program is going to make more sense and how that's going to provide better value and better capability for those security programs, and therefore hopefully have more money available for patient care and make sure that we're securing that patient care environment in a way that is more robust and better able to handle the attacks coming towards it without having to pay the ransom, without seeing a huge increase in insurance costs, and without becoming, front page news on any of the nation's newspapers.
So as we walk through, this framework, then how does Deepwatch as an MDR provider help to solve all of the unique challenges that we've been talking about today?
So Morgan, I think this is a place where we're uniquely situated to help folks in the healthcare industry. As you mentioned, one of our top 2 verticals, always neck and neck with financial services folks, and that's not really to be all that surprising with the high amount of regulation that both industries face, things along those lines. So as I mentioned, we really see that security programs almost always do a pretty good job with the protect step in that NIST CSF. Where we see that we can help our customers is help them through the journey of detect to alert, we had one in there, to respond to recover. And let me talk about each one of those just a little bit here. We're talking about detecting. We're really talking about being able to take the great security data that your security program already generates. Every one of those 76 security tools that you may have deployed is capable of providing you logs. We know that maybe not all the IoT equipment in your environment has anything in terms of security logs, but we know that you've got tools out there, they're deployed, whether it be your authentication system like Active Directory, whether it be your DNS and web filtering system, whatever those systems are, we know we can pull great information from those systems, analyze it, correlate it, compare it to other data from other systems you have, compare it to third-party data from data suppliers, compare it to our own intelligence, the things that we've learned, and we can detect what's going on in the environment. We added this alert step in. Obviously, that's not part of the NIST CSF, but we think it's very, very important because alerting is so critical to what are you doing with the data you detected. Certainly, we don't want to alert folks to every little thing that happens. I know I'm going to detect, Morgan, when your account may be being brute force hacked by somebody who's repeatedly trying passwords against your account. On the other hand, I'm probably not going to alert anybody to that because it's every bit as likely that you accidentally left caps lock on the day after you changed your password, and it took you 10 tries to recognize that.
Right.
And no, I'm not picking on you. I know plenty of people who have done that, and I'm not even going to say I've never done that. But it looks the same to me as I'm detecting it. So we have to be able to help our customers with the alerting, and that alerting is a very important balance between over alerting on small stuff like that isn't perhaps meaningful, but also under alerting because it did turn out that you were actually brute forced. And then a few days later, maybe somebody installed a new service on your laptop, and a few hours after that, your laptop started doing Nmap scanning of the entire network. Once I've got those three bullets together, I've got a story to tell about what's going on with your account, Morgan, and I can now alert our customer that there really is something happening and now they need to work on it before it turns into your laptop being patient zero for a ransomware attack. And that's where we talk about respond. Once we've got a great alert, whether we're giving that alert to our customer or we're using that alert internally ourselves, now there's the opportunity to respond. And we want to be able to respond at the speed of automation. Folks talk about XDR. That's really, to me, what XDR is about. XDR is about taking that great alert, taking that wonderful information, all the stuff we've detected, and being able to take a quick step through automation to pause whatever bad activity might be going on. And we need to do that at the speed of automation because that's how fast the malicious things are working. Oftentimes those malicious activities are done in code. You don't need somebody sitting at their keyboard in their black hoodie, right, stereotypical hacker, at the keyboard to start doing the bad things in your environment. They've written their software and it can go do it itself, at least up to a point. We have to respond as fast. And so we respond by maybe kicking a workstation off of the network. We respond maybe by making a user have to go through multi-factor authentication again because we don't think that's really them logging in the second time, or other things along those lines that are going to allow us to pause whatever bad thing is happening and give our people time to go figure out what happened. And that's when we get to recover, where we can eradicate the malware from the environment, where we can disconnect that connection to the malicious user who's doing things, where we can get our company and our partner back to at least status quo, if not better than status quo, so that the next time an attack of this sort occurs, they're protected against it instead of having to detect it, alert, respond, and recover. So to do that, Morgan, as you know, Deepwatch has an entire platform worth of offerings that we utilize in order to help our customers out. We start with managed detection and response. We can add that extended detection and response where we're now taking those automated actions for our customers. And by the way, that's a lot trickier than it sounds. You can't even think about that in terms of the 80-20 rule, because if we're taking action 20% of the time when we shouldn't be, that's a huge disruption to business. So we've had to put a lot of time and effort into making sure that we make the right decision and take the right action, and that we don't take action when it's unwarranted. huge sorts of things that are very difficult for security programs to do on their own. The person years of development in here, not something that the average organization is going to hire an engineer and get done anytime real soon. So between managed detection response, extended detection response, managing endpoint security for our customers, vulnerability management and firewall management, this is our operations platform that allows us to provide that full suite of capability from detecting to alert to respond to recovery to help our customers who have a great protect program in place, or maybe they don't, but still need help with those other key things that are so critical to a working security program. Because somebody's always going to get past your outer defenses. Somebody's always going to get past the firewall. They're always going to be able to trick that endpoint tool. Somebody's going to be able to do it. And how do we deal with that once they do? I think Deepwatch, to kind of put a bow on some of this, Deepwatch is unique in the marketplace in terms of how we do it. And I think it all starts with doing this with people. We're here to solve problems with people, and so all of our customers end up getting assigned to a named squad. This is the small team of folks that are going to support that customer 24/7, 365. So they always know, Morgan, if you have an issue in your environment overnight on a weekday, you know the analysts that are going to call you at 2 a.m. and say, Morgan, got to wake you up. Here's an issue we got to work with together on. You know that individual. They know you. They know what makes your particular organization, say the hospital you support from a security perspective, completely different from any of the other hospitals we support, or the manufacturing companies that we support, or the data companies that we support. They know what makes your company unique. They have what I like to think of as that institutional knowledge about your environment, so they know this is an alert they need to send to you, and they know why they need to send it to you and what might make up a false positive in your environment. So you've got that team, and you're going to build a relationship with them, and you're going to have communication with them as often as you want through tools like instant messengers, through phone conversations. We stopped using fax machines just because, but you know, if somebody wanted to communicate by carrier pigeon, we might be able to figure that out too. We want to make sure that there's a great person-to-person people relationship with our named squads and our customers.
That's really powerful.
So every fantastic security solution does require great technology, and our SecOps platform, I would tell you, is second to none as well. That's built on a couple of different things. Number one, a lot of great commercial off-the-shelf software and tools, because let's face it, why would I reinvent a perfectly good wheel if there's a perfectly good wheel out there? So we've got those wheels that we've bought, but we've glued them all together onto our own chassis and our own frame. So a lot of intellectual property has gone into our use cases and our playbooks inside of our SOAR platform and how we do the XDR response and how we make things happen. But it all ties together with a lot of industry leading security tools that we bring as part of our package, because it takes more than just a SIM to have a good security operations program. The return on investment working with Deepwatch is fantastic. For anybody who's curious or interested, come on to the deepwatch.com website. We have a Forrester Total Economic Impact study on the website showing the greater than 450% return on investment that our customers can expect in time working with us, through freeing up people from spending their days staring at consoles waiting for alerts to happen, to migrating them to doing things more productive in your security program, as well as being able to provide this capability for far less than you'd be able to do if you had to try to staff it yourself.
Especially in a time, you know, budgets, not just for healthcare, but across the board, are getting extremely tightened and restricted. So
economic uncertainty, you know, 2 days ago, we all heard the news about what the Dow Jones did, you know, 4 points lower just on speculation. We've obviously it sounds like just averted a major rail strike that could make all sorts of things cost a heck of a lot more because of scarcity. Yeah, it's good to be thinking about these things and planning your security program around the economic impacts all around us. Absolutely. Continuous improvement is a huge part of our promise to our customers, and we see that in two different ways. First, we actually have our own patented maturity model, Deepwatch Security Scorecard, Security Score, excuse me, the card isn't there, Security Score. that helps our customers do a couple of different things. Number one, you can compare yourselves to our industry average for your peers. Every board member I've ever met has asked me the question, so how do we compare to our peers? This is a way to tell them that. This is also a way to tell them how we want to improve the security program over time and justify why we're doing that so that we can help get budget from them as well and help get their buy-in on why we're going to do this. Anecdotally, we've got, again, another customer use case talking about doubling their security program's budget through this methodology. But that's just half of continuous improvement. The second half of that is we aren't sitting still. We aren't resting on our own laurels, such as they may be. We're continuously improving how we provide this solution. We literally just came out earlier this year with a solution that we call TPV, threat probability value, that has drastically improved our signal to noise ratio, has lowered the number of alerts that we have to send to our customers while increasing the fidelity of those alerts, making sure there are fewer false positives and, even better, fewer false negatives. We're alerting people of things that we couldn't see before because we've continued to improve our program and made it better than I would dare say anybody else in the industry. And we do that every year through new innovations and new capabilities that are just part of the program that we provide for our customers. And then finally, that accelerated detection. It's no good to detect the bad activity after the burglars left your building. You want to detect them as they're putting their hand into your jewelry box, into your safe, whatever, not after they've left with all your valuables. And so we accelerate detection through some of those tools I've talked about, through TPV, through being able to take that pause action through an XDR capability to stop something that looks malicious and give ourselves time to investigate it before it can do any more damage. These are the reasons customers come to Deepwatch, because we can bring these capabilities to help them solve for their security operations issues. Those issues are usually problems like alert overload. Too many alerts coming in, can't do anything about them. Inability to respond quickly to threats because we can't detect them in time until they've turned into big issues. What Colonial Pipeline must be wishing they had in terms of an ability to detect that ransomware in their environment for any part of that week before they finally triggered it and started encrypting files, things along those lines. Those are the sorts of things that we're solving for with this approach, with that platform of capabilities that we have. That's what we think we bring to especially the healthcare providers who need help with their security programs in industry throughout the United States.
This is great. I mean, we went through, like I said, there was a lot of amazing statistics and the factors and everything. And I think this has been great. So we have a little bit of time for questions, actually. So why don't I see what's come through? And then, so again, feel free to use the question and answer box if there's anything that you were thinking of or are now when we ask some of these questions. And then we'll certainly, if we don't have any time, we'll get to those, make sure we follow up with you. So the first one, Bill, do you see cyber insurance providers pricing out healthcare providers?
That's starting to get a little scary, right? The reality of that is it may happen. We're seeing the insurance providers having issues with trying to further restrict what they're going to pay for. We're seeing them require more and more safety capabilities already built into your security program. Believe me, that part's a great thing. I think of it as in my auto insurance, I get a discount for having cruise control that will automatically brake so I don't run into something when cruise control's on, things along those lines. But when I hear about a security, a security premium going up 15 times what it was, and admittedly, that went up 15 times in part because that particular entity had gotten breached and there had to be a payout. But when I hear about those kinds of price increases, I do start to worry about that. And so I want security programs, especially at healthcare providers, to have the capability to detect, respond, and recover when an event happens so that they can handle it before it becomes front page news, before it becomes something they have to disclose, before it costs them that money. And if that happens, I think a couple things can occur. Number one, those healthcare cybersecurity insurance premiums can hopefully come back down at least a little bit. But number two, that potentially gives that organization the opportunity to start thinking about self-insuring. If their program can become more robust, they have the opportunity to seriously consider that as an alternative to the premiums that they're getting asked to pay.
Great, thank you. That's very, very insightful, where everything's going right now. So we did get another one that came in. What are some of the best practices around IoT environments?
Yeah, IoT environments are amongst the toughest environments to protect. One of the problems that we have, whether it's healthcare IoT, manufacturing IoT, your Roku in your home, those tools were never built to do a couple of different things. They were never built to update as fast as we update software on things like computer infrastructure, traditional IT. So you may be running systems that have very, very old operating systems. There's no longer patches for that operating system, which is especially, of course, concerning to those of us in information security. The other part of the problem is you don't get visibility from those tools. When a lot of those IoT tools think about sending logging information, they're sending operational logs. Again, in terms of healthcare things, they're going to send the information about my blood pressure and my pulse rate and my pulse ox and my respiratory breathing rate, but they're not sending information about Bill Bernard just logged into this device. That's stuff that we're not getting from those. So that means that we have to build better detection capabilities around them. So more network monitoring, especially for those IoT device networks. Obviously, the best case scenario is that they're on entirely closed networks, but we know that doesn't happen most of the time. Healthcare, especially as healthcare is has to be open to those external services providers like those third-party monitoring sites for the off-site monitoring of ICU beds or the third-party imaging site, things along those lines. We know that those devices are on mixed networks where there is IT and IoT and where there may even be internet connections. So network level monitoring, where you have IoT devices that you can update and patch, obviously update and patch those, almost goes without saying, but I'm going to say it anyway. All of those sorts of things, and being able to minimize what those networks can get to, even if for some reason they have to have some level of internet access, being as prescriptive as possible. I think about IoT devices a little bit like I think about networks from 20 years ago. The best practices from back then about segmenting them, about being very, 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 very restrictive with permissions. What are they allowed to talk outbound to? Hopefully only well-identified systems outside of their environment, things along those lines. If we can start there and then add better detective ability around the network level itself so we can see the traffic that's passing back and forth, those are good starting points. But unfortunately, I think we need IoT manufacturers to maybe start taking their responsibility for information security a little bit more seriously as well. That's going to be a hard thing to make happen without, especially maybe in the healthcare space, some legislation that holds their feet to the fire a little bit differently.
Very true. Okay, well, I don't see any other questions that have come through, but I know sometimes they certainly will hit you either later in the day, or me is usually right before I'm falling asleep. So certainly if they come to you guys, or you watch this again later, feel free to reach out to us, and we're certainly happy to take those questions. As I did mention, this was being recorded, so we'll be sending the recording out to you guys, and you can certainly pass this along to any of your colleagues that you think might find this interesting as well. Big thank you to everyone for joining us and taking some time out of your busy day. Thank you, Bill, for taking time out of your busy schedule to be with us today and walk us through everything. We hope you guys were able to take away some, actions that you can take to mature your cybersecurity in the midst of the ever-evolving healthcare security threats. And we hope to see you on one of our next Deepwatch events. We also have this healthcare page that we've put together with some of our other webinars, some of our assets focused around the healthcare industry. So feel free to use this QR code. If you don't like the QR code, just go ahead and type in deepwatch.com/healthcare, and that will get you there as well. So big thank you again to everyone, and to Bill, and we will talk to you guys soon. Thanks so much.
Thanks, everyone. Thank you, Morgan.